Thank you, everyone, for being here today. Today I'm announcing some further steps designed to protect Saskatchewan people, to flatten the curve, if you will, and to provide clarity around what kinds of businesses and which kinds of critical public services can continue to remain open and continue to operate in the province of Saskatchewan. As always, these measures are being taken on the recommendation of our Chief Medical Health Officer, Dr. Shahab, who continues to provide Saskatchewan people with strong guidance on what each of us should and shouldn't be doing during what is a very challenging time. Today, under the authority provided by the provincial state of emergency, I am ordering no public gathering of more than 10 people. The government has also released a list of critical public services which will continue to be provided, and a list of businesses that can remain open in Saskatchewan, while of course ensuring safe social distancing practices for employees as well as for their customers. You've seen the list, each of you. This will mean further closures, yes, of some businesses that are not present on that list. For example, clothing stores, shoe stores, flower shops, sporting goods stores, vaping shops, pawn shops, travel agencies, jewelry stores, just to name a few. If any business is uncertain whether they are allowed to stay open, the list will be posted online on the Government of Saskatchewan's COVID-19 website. And if you still are unsure, or if you feel that it is essential that your business is allowed to stay open during this time, you can contact the government's business response team. And I should note that if you are a business that is required to close to the public, you can make the choice to continue operating online or as a delivery service. So as long as you are ensuring that there is safe social distancing measures in place for your employees and any of your customers. For instance, a flower shop could still do deliveries if they choose and ensure that safe social distancing measures are in place. I know everyone right now is trying to find the right balance between social distancing and keeping our economy in Saskatchewan going. But we are already seeing Saskatchewan businesses that are adapting and evolving. Saskatchewan businesses are creating a new economy, a social distancing economy, if you will. Saskatchewan businesses are already doing this. For example, they are limiting the number of people in their stores. They are reserving certain hours for seniors. Doing more business through delivery and online options is common today. This is a huge change for all of us in how we live and how we work. And I want to commend all of the workplaces and all of the employees who are finding new ways to operate in this new social distancing economy. I also want to note today the Saskatchewan Public Safety Agency has launched a dedicated toll-free line for people who have general questions about the COVID-19 pandemic that are not necessarily health specific. For example, questions about government services or travel restrictions that may be in place. We want to ensure that the 811 health line is being used exclusively to respond to health-related questions. So to be clear, if you have a question about whether or not your business can remain open, call the business response team at 1-844-800-888. For health-related questions, as always, call 811. And for any other questions that may be related to COVID-19 pandemic here in the province or the response to the COVID-19 pandemic in Saskatchewan, please call the Public Safety Agency at 1-855-559-5502. And of course, if you want to see all of the latest provincial information about COVID-19 and the Government of Saskatchewan's response, visit the Government of Saskatchewan's website at saskatchewan.ca. I know today that we are asking a lot of everyone in Saskatchewan. Whether you are working in one of the businesses or services that is staying open, or whether you work in one that is now closed and you are at home. Each and every one of you need to know that you are doing your part. Every one of you is part of a massive civil defense effort to protect our people, to protect our families, and to protect our province. Unlike anything most of us have seen in our lifetime. We are asking a lot, but it is necessary, and it will reduce the risk. So once again, to everyone in this great province, I want to say thank you. I want to say thank you for each and everything that you are doing. And Dr. Shahab will have a few comments.
Thank you, Premier. So I just have a brief update from the health side. So as you saw in the news release, we have 14 new cases reported since yesterday. Investigations are ongoing. The provincial total now is 86. 4 are 19 years of age and under, 69 are between the ages of 20 and 64, and 13 are 65 and older. There has been no change in the local transmission numbers so far, but we're awaiting completion of investigations that are ongoing. We are reporting 4 hospitalizations at this time, 2 in ICU, 2 in hospital in Saskatchewan. We can't provide any more specific details in terms of which hospital, and some of these hospitalizations are due to underlying medical conditions with COVID-19 as a diagnosis made either before hospitalization or during hospitalization. So as I said earlier, all hospitalizations where there's a respiratory component, they are screened for COVID-19, which is good. And of course, our tests now are 6,270. COVID-19 tests have been performed as a proportion of our population. They are on the higher side in Canada, so we are testing extensively. And as I said yesterday, we are testing people who are symptomatic after traveling, who are symptomatic and may have been at a large event, who are household contacts, and now also people who have respiratory illness and may not be hospitalized but may be seeking care because of their underlying condition, but also have symptoms, consistent with a possible COVID-19 diagnosis. To date, most of those tests, for example, most of the tests done in the hospital setting remain negative, but we now have 4 hospitalizations, and some of those tests were picked up during hospitalization, so that is really good. We continue to test in long-term care facilities. We have so far had no outbreaks in long-term care facilities. Other provinces have been reporting, so it remains essential in terms of being very thoughtful about visiting a loved one in a long-term care facility. Many long-term care facilities only now recommend visiting in extremely rare instances, but otherwise minimizing traffic in and out of long-term care facilities. We have now started posting all the information regarding airlines. As you know, previously we would contact people who were sitting in the 7 rows where they could be at higher risk. Now, of course, it doesn't matter if you are traveling internationally, if there was someone on an aircraft internationally, because you have to stay home for 2 weeks and monitor your symptoms. But if you were on a domestic flight and there was someone who was symptomatic, anyone who takes a flight in Canada now, for the next 2 weeks, they should go to the Ministry of Health website and check if the flight they took is on that list. And if it is, there's rows that are marked. So, you should keep your boarding pass with you to check were you in those rows or not. If you're not in those rows, your risk is lower. If you were in those rows, you are to self-isolate. So that's just a check for you in terms of your risk after airline travel. As the Premier mentioned, there's really updated information on the COVID-19 website. The self-assessment tool really helps you to decide if you should call Healthline for further questions, and that really has resulted in a streamlined approach to people calling Healthline and then being directed for testing if their history, travel history, or even without travel history, the symptoms suggest that they could benefit from getting a COVID-19 test. Thank you.
Thanks very much, Doctor. We have time for questions now. We're going to have our first question from the phone line. Operator.
We have Adam Hunter with CBC.
Hi there. Thanks for taking my call. I would like to ask the doctor why we're not getting more detailed breakdowns of the health information as far as age groups, male, female. We get a general percentage, but the age groups seem to be pretty wide, 20 to 64. Why not provide more detailed information on age breakdowns, male, female? This wouldn't identify these patients, but it could help the public better understand who's being infected and just the risks as far as the higher number of people, I guess, under the age of 65 that seem to be affected in the province.
Yeah, we were trying to get enough numbers so that we could start breaking it down, which we now are. So we will start getting that more specific information in terms of breaking down the age groups between 20 and 64, maybe into two age groups between 20 and 64. Now that we have bigger numbers, and in terms of testing, yesterday I had said that, and today's update actually that the data I got this morning was that the 6,270 tests that were done, about 60% were done in females. The testing rate was higher in females than males, and part of that is because there's, of the healthcare environment, there's healthcare workers also get tested just to screen out if they have symptoms. But of all the cases, about 60% are males, 40% females. But that's a good point. We need to get better information on the website. And now that we have numbers that are large enough to get that, tabulation, we will be doing that.
Is there a follow-up on the line?
Just a follow-up for the Premier. The Mayor of Prince Albert had asked today that the liquor stores be closed. I'm asking, I guess, what the thinking is on that to keep them open, and whether there'll be restrictions perhaps on liquor sales.
I won't speak to whether or not restrictions are being considered. They aren't in what we have here today, although we did have a conversation around specific around liquor stores and publicly owned liquor stores as to whether or not we should close those stores. Two reasons to not close them. One, this is no time to add to any of our detox capacity, if you will, add people into that system or any of our addiction services. The second reason would be if we were to close the publicly owned liquor stores, essentially what we would be doing is driving customers to a smaller number of stores in each of our communities, being the private stores, thereby adding to the number of people in those particular stores. So that is one that we did have a conversation around. Specifically, this is where it is at this point in time. I would say, however, that this list will be looked at not only on a daily basis, but most certainly will be looked at for 2 weeks, and it's effective for 2 weeks. And then we will be looking at the list in its entirety as to should we contract the number of businesses that are on this list, should we leave it the same, or should we look at expanding it at some point in time. What we're trying to put forward here with this list is clarity for businesses in the province so that they know which public services are expected to operate and will be required in our response to COVID-19, and which businesses can remain open.
Britton?
Speaking to the airlines and the information being put out there, we just received information from people who said they've tested positive for COVID-19 and their flights aren't on there, even though they've shared the information. So I guess, how up to date are those flights? Because some of them said they've tested positive for a couple days now already.
So yesterday we did put all the information that we had in the ministry. If they don't see their flight, they should call public health and to confirm, because there is a 36 to 48 hour lag because the investigation is done, and then and then the other thing is that if you were asymptomatic during travel and you develop symptoms 2, 3, 4 days after arriving, then there's no need to post the airline. It's only done if you were symptomatic during your trip.
And so I guess, is there a way to streamline this information? Because they said they were feeling symptoms pretty much as soon as they got off the flight, and they've been in self-isolation since and everything, but they still haven't seen their flight up there.
Yeah, well, I think they need to call public health and flag that, and I'll also flag it for my public health colleagues to reconfirm if. But we are getting that information as a matter of routine as investigations completed. But I'll reconfirm that on my side. But if someone feels that they were symptomatic on a flight and their flight is not on the list, they should call public health.
And I would say we have now the business response team that is at one number. We have the 811 health line for those that may be requiring a test. And if people have information just like this that maybe hasn't made it through the process to go up on the website for all to see, I would just ask them that they call the Public Safety Agency, which is the agency that will encompass any of the other information that we need to gather or provide any of the answers that people need. So if you feel that you've been on a health that has not yet, or a flight, pardon me, that has not yet been put up as being one of the flights with a positive ID individual on it, please call 1-855-559-5502 and let them know, and we'll endeavor to provide that information as soon as possible.
Steph?
I just wanted to follow up on your answer, Mr. Premier, about why one of the reasons you're keeping liquor stores open. You say it's no time to add to detox or addiction services. I guess kind of, can you expand on that, and have you been advised that, say, closing liquor stores could lead to people going through withdrawal? Can you just kind of get into that a bit?
That would be the concern. That would be the concern, is that if we were to close those stores, that there may be people that would go through not only withdrawals, but be added into a system that, we are making efforts in normal times to expand, to address the demand here in the province, not only with alcohol, but with other addictive substances that we have present in the province. So we didn't feel that this was a time to potentially add to those stresses that we have in the health system already, and stresses that we have in families already, as well as by closing only the public stores, we really would be assembling more people in a fewer number of stores. And the whole goal of this list and providing this clarity today is to give businesses, give the public added opportunity to practice effective and responsible social distancing practices. We are in a different economy now for the time being, and it's a social distancing economy.
What's the thinking behind, and correct me if I'm wrong, allowing cannabis stores to stay open? I noticed that vaping shops will have to
Right.
be closing, but why cannabis?
Well, one of there's still vaping supplies that would be available at convenience stores, I understand, and I've never been in a vaping shop, but one of the things that I've been informed of is in some vaping shops, there is the opportunity to test products, to touch and test products, and to actually put them in your mouth and others. So we've just included that in. This is likely not one of the businesses that is necessary to be open today, and so thereby it's not included on the list.
But in terms of, sorry, cannabis, why would that be deemed kind of a necessary one then?
For that I don't have an answer for you. We can provide an answer, Steph, specific to cannabis, but it is not on the list.
We're going to go to the line for the next question, operator.
We have Phil Tank with the Star Phoenix.
Hello?
Yes,
Phil, are you there?
Yeah, why the number 10? How did you arrive at that number instead of a lower number like 5? 5 is a number we've heard elsewhere.
So again, I'll start by, if you go cross-country checkup, there's wide variation among provinces. BC, Alberta, 50-50. We were at 25, initially 50. All three of us were at 250 at one point, came down to 50. In the US, similar. There's no magic number, like I've said before. Right here, maybe we are 12 people, but as long as we're 2 meters apart, like I said yesterday, there's no risk. But even 5 people crammed into an elevator is 5 people too many. And like I said yesterday, it's also how you interact. If you are sitting in a room, 5 people having a conversation 2 meters apart or outside, that is fine. If you're playing a board game, if you're part of a household, you're living together anyways, that's fine. But you shouldn't do things as a group where you're passing things back and forth. Because I think that increases the transmission risk. And same applies to retail establishments that are open. Even there, the way you, whether you're picking up your food order or picking up anything else, the way you operate even now in that setting is you go, you pick your order, you leave, you don't touch multiple things in that establishment, and businesses are adapting to really try to meet a very high standard from their side to make sure that everything happens in a very streamlined way now.
Is there a follow-up on the line?
Yeah, can you clarify the number of hospitalizations at 4? Are these the first hospitalizations that you've reported? And you said 2 in ICU, 2 in hospital, and that they all had underlying medical conditions, or some of them had underlying medical?
So yesterday, the information we had was that there were 2 hospitalizations, primarily due to underlying risk factors. Today, our updated information is that we have 4 hospitalizations, 2 in ICU, two in acute care floors. We don't have enough information regarding of those 4, which were primarily due to COVID-19, which were due to COVID-19, but other underlying illnesses as well, and which were due to primarily other underlying illnesses. But then, whenever someone develops a respiratory symptom, either on admission or during their stay, they are screened for COVID-19. As our numbers for hospitalization increase, we will try to get that information. But this is a number that will keep changing because experience from other Canadian jurisdictions has shown that most people have mild symptoms, they do well at home, and after a period of 2 weeks, they clear the infection. Some require a short period of hospitalization, which may be as little as less than a week, and then can again come home and stay at home till they've cleared the infection. But a few may require a longer hospital stay or ICU care. So that is the pattern that we have seen in other jurisdictions. So as our numbers unfortunately increase, we will be able to report in more specificity. But at this point, this is the only detail we have.
Lisa?
On the second reason that you said that you didn't want to close liquor stores, you said that you didn't want to push people to private liquor stores, but if liquor stores weren't on the allowable business list, then private would have to close too, would they not?
This wasn't the larger part of the conversation that we had with this list, but if we were to close, the conversation we had around was public liquor stores and closing public liquor stores, and if we were to just close those, it would push larger numbers of people into private liquor stores that we have. That may change in the weeks ahead. I'm not sure of that today. But what we did want to do with this list was bring out some clarity for the business community here in the province, the entire business community, on which public services are going to be provided in the days and weeks ahead, and then which businesses would be deemed allowable to operate, understanding the industries that drive the economy here in the province. And there is a balance here that we're trying to strike. I don't know if any country has quite rightly figured out precisely where the balance needs to be, but we are doing our level best to find it here in Saskatchewan, ensuring that, for example, the supply chain for agriculture is still intact, so that we can get a crop in the ground this spring. That includes potash mines operating so that we can have access to potash, a valuable fertilizer for agriculture. So we can ensure that the lights are on and the heat is on in all of our buildings, and that the power is being supplied to our communities. And then other businesses that would be able to ensure that social distancing mechanisms are in place, safe social distancing mechanisms are in place, and still have some semblance of normalcy, understanding that the actions that we have taken over the last number of days have addressed many of the businesses that you don't see on this list already, albeit there are a number more that will be affected and impacted with today's announcement.
So you're saying the list was kind of created in a way to help keep the economy going. How do car dealerships fit into that?
And the economy going, and our families safe, and our ability to get around. The service and parts that are available in automotive dealerships, for example, are necessary for us to continue with some ability to get around in this province. In saying that, are ATV, snowmobile, boat dealerships necessary for us right now to be open? Likely not. So there's the distinguishment in between those. Agricultural dealers, for example, we want them to be open so that we can have that supply chain for agriculture available to our farmers this spring.
We're going to go to the line for the next question, operator.
We have Jonathan Guignard with Global.
Oh, yeah, thanks for taking the call. Just having concerns from listening to Saskatchewan Union of Nurses in regards to personal protective equipment, specifically the N95. And there was just concerns regarding the availability of those and not having the right equipment for just to properly do their job. What's kind of the update there, and what do you tell them?
Well, I'll speak just briefly to the two products that I think most jurisdictions in the world are looking for and are in short supply worldwide are ventilators and N95, the masks or respirators. I was on the phone with a neighboring jurisdiction to the south in got one of the governors of the U.S. This morning. We were discussing precisely this issue. There are different supply chains for the N95 masks, if you will. Many of them are produced by a company called 3M that is manufactures in numerous different places, but based out of Minnesota. So we had discussions about where they are going with their supply, and it looks like supply will be ramping up. So we're hopeful for that, not only for us here in Saskatchewan, but for all of North America, as well as others that might access from that particular company. With respect to the ventilators, both of these have been a topic of our Premier's calls, multiple calls over the course of the last number of weeks. Is there capacity in Canada to start producing ventilators for us to use right here at home, and we believe there is. And so there are multiple companies in multiple jurisdictions that are discussing the opportunities that they have to move forward with a Canadian solution to providing ventilators for Canadians first, but ultimately even to others in the world. Do you have anything to add to that, Doctor?
Yeah, so I'll just say that in the healthcare field, already the way care is provided is going through a change for the foreseeable time. So even in primary care clinics, there are opportunities where you can call and have a telephone consultation, where you don't need to be in a physician's office. If you are there for other needs which are emergent, but it's not a respiratory illness and you haven't traveled, care can be provided safely with just hand hygiene. So a mask is not required, either in the hospital setting or the primary care setting. Where you have a respiratory illness and you need to be assessed in a hospital setting or a primary care setting, the recommended personal protection equipment is mask, a procedure mask, eye protection, gloves and gown, and those supplies are not under any pressure. And like Dr. Susan Shaw said about 2 weeks ago, that when she works in an ICU, when she has to do an aerosol generating procedure, which could be intubation and those kind of procedures, at that time only is an N95 mask required. For those procedures currently there is sufficient supply, but we all have a role to play to conserve the supply and only use an N95 mask where it's clearly required and not where a procedure mask is sufficient protection for routine droplet precautions. And we have to remember that all the transmission events in large gatherings, they have not been even droplet. They have been through touch and this, touching a surface which is contaminated, and then touching your eyes, nose, mouth. So that is actually the most important thing for not in just the healthcare environment, but for all of us to practice when we're out shopping. Wash your hands when you come back. Avoid touching your eyes, nose, and mouth when you're out and about after opening a door. I think that simple learned behavior as part of social distancing and infection prevention and control is essential behaviors we have to practice all the time.
I just say make one other comment on the N95 masks themselves, as we hope that the supply does free up sooner rather than later. And I think, in fairness, I think many jurisdictions, in particular provinces and states in North America, are hopeful of that, and I believe it will. In saying that, I think this is an area where we could just mention how grateful we are for a number of different businesses and industries, the heavy construction industry, the Crown corporations and others in this province that do have supplies of N95 masks on hand. They've provided those to the Saskatchewan Health Authority, and for that we say thank you.
Is there a follow-up on the line?
No, that's good. Thank you so much.
Perfect. Mark?
So you were talking about liquor stores staying open. AA meetings and NA meetings can't go ahead with the new restrictions. Is there anything going to be done to help people who are dealing with those addictions?
Well, like I said, we have set the limit at 10 people. With respect to AA meetings, and we all have friends and loved ones that would attend meetings just like that. Those are precisely the things that may not actually be over 10 from time to time. If they are, and it is deemed that they do need to be over 10 individuals, those are things that we would ask that you reach out to the business support line which will be handling this. And if you feel there are meetings or your business actually does need to remain open during this address to the COVID-19 pandemic, we're willing to listen, and we're willing to work through those on an industry by industry basis. We're also willing to work through those at the very granular level of business by business by business level to ensure that we get this right. We want to ensure that our families and our individuals in this province are safe, as safe as we can possibly be. But we also want to ensure that where we can, we're minimizing not only the impact to the economy, but in this case, minimizing the impact to people's personal lives and the supports that they will need. So that would be an example of exactly where we maybe want to have the conversation. Is there an opportunity to keep those numbers below 10? But if they have to be above 10, let's have that conversation on how we can do that with safe social distancing practices in place.
Staff?
Dr. Shahab, I'm wondering if you can just clarify which age groups the 4 hospitalizations fall in. There's like obviously the 19 and under, 20 to 64 and 65 and older. Can you just say?
So I don't have that information at the moment, but as, unfortunately the numbers increase, we will be able to provide that, breakdown. But from what we have seen from other countries is that a hospitalization and ICU can happen in any age group, but it's more common in 65 and older and those with underlying health conditions. But we'll try to provide more specification over time.
And Mr. Premier, I just want to ask, have you given any consideration to releasing inmates from any of the provincial correctional institutions in order to maybe reduce crowding and the potential spread of COVID-19 in those facilities?
So we have our population that's incarcerated here in the province is high as a percentage of the room that we have. So there are discussions going on as to how we manage that degree of population in our province's correctional centers during this time, and what protocols would be in place should this COVID-19 enter into the prisoner population. So there are options. That's one that has been reported on. There are some other options that we're actively looking at as well. We haven't made the decisions on what those options could be, but there are multiple options that we're looking at on how to manage our incarcerated population over the course of however long this might be. This is one of the reasons why when we had brought out some of the restrictions, not only in long-term care homes in our hospitals, as well as our group homes, that we extended those very stringent restrictions, visitation restrictions to our correctional centers, is to try to be ahead of any challenges that might come. There would be the first step, but there are some other options that are being discussed now.
Go to the line for a next question, operator.
We have Guy Quinville with CBC.
Yeah, thank you. A question for Dr. Shahab. Are there any, among the now 86 total cases, any new cases of community transmission to report? And if so, which specific communities are they in?
So at this point, we only have the 4 community transmissions I reported yesterday. We have to remember that these additional cases were just tested positive, reported late yesterday. So while we do announce new test positive the next day, the investigation itself can take anywhere from 24 to 36 hours, sometimes longer, to determine the exposure. But as that information comes, obviously we will be updating on our media updates.
Guy, I talked with the Minister of Health this morning, specific to trying to be as transparent as possible with the information that we're providing through the media to the people of the province. Information like ages of those that have tested positive, their locations in general, as well as the numbers that are hospitalized, and I think also the numbers that have had COVID and have recovered fully from COVID. Some of those numbers, is there an ability for us as we move through this, and we're finding our way to become to be as transparent as we possibly can on that. So we're if you just to be a little bit gracious with us, we are endeavoring to get to a level of a higher degree of transparency on those types of reporting, and we're attempting to get there as soon as we can.
Is there a follow-up on the line?
Yeah, again, thank you for that, Dr. Shahab. Today's increase is 14. But I want to ask you, you've talked about, the snowbirds that are returning to our province, especially since Trudeau said, come home. Should Saskatchewan residents expect in the days to come a massive increase in cases in this province due to that segment of the population, especially those coming back from the United States? Should we be girding ourselves for perhaps the largest single-day increase we have seen thus far in the days to come?
Yeah, so that's a really good question, and I'll again say that we have to watch 3 or 4 trends very carefully. Yes, we will see more people returning who can and should return back to Canada. So because of that, we will see a proportion of people who are returning test positive. As long as they are self-isolating for 2 weeks, we should see no further transmission in the community. We may see, in addition to that, household contacts of people who are returning that test positive. So that's one group that obviously we're monitoring, and that's the major proportion of our cases so far. We have seen a significant number of cases from 2 mass gatherings, which were a dental conference, another event, a curling event, 2 curling events. So we have seen about 16 cases in total from those 2 events. But again, as those group events are becoming smaller and smaller, and restrictions on the settings in which those events happen, we hope to see less cases from those events as well. Obviously, we are watching community transmission very closely, and I would like to add that we get requests that why don't you name the community where a case is. We have to remember that even people who come back after traveling or otherwise, they may have symptoms that are so mild that they may not even call Healthline and ask for a test, and that's fine. If you just have a dry cough, as long as you stay home for 2 weeks, you don't need to get tested, and there's no risk to the public as long as you are self-isolating yourself. But we have to remember that there will be instances where there will be community transmission which may be so mild that it's unnoticed, till someone 3rd or 4th person down the line gets sick enough to require testing. So that's how we define community transmission, that you can't trace the source. That will happen. We want to keep that at a minimum by requesting cases, people who've traveled, to isolate for 2 weeks very strictly. But that by itself implies that just naming where cases doesn't help, because all of us have to do the same behaviors everywhere, which is social distancing, very thoughtful about touching a surface and not touching our eyes, nose, mouth, washing our hands, cough etiquette, maintaining that 2-meter separation. That has to apply everywhere in Saskatchewan, because and shouldn't apply just because you live in a community where there was a case. So I think that is essential for us to remember going forwards.
I would just add, and this was a question yesterday about just remembering the context in which we are entering this COVID-19 pandemic. And if we just compare for a moment to what happened in China, there's about just over 80,000 cases that occurred, positive IDs that occurred in China. That's in an area where COVID-19 was allowed to really spread for 10 weeks before they really even identified what it was. China's a population of over 1.3 billion people. Understanding COVID-19 wasn't predominantly right across China. It was concentrated to, I believe, the province of Hubei, where there's about 56 million people in that particular province. And even more so than that, those 81 or 82,000 cases were concentrated into the city of Wuhan, about 11 million people. When you extrapolate that to Saskatchewan's numbers, understanding that Saskatchewan is a very different place than the city of Wuhan, we're about 10% of the population. So if they had about 80 to 83,000 cases there, Saskatchewan may be looking at maybe about 10% of those particular cases. So in the days ahead, my point being, we're at 86 today. We should expect more cases, both travel-related as well as community transmission in the days ahead. This is a pandemic that is in our nation, it's in our province, and we will have more cases in the days ahead. But I think it's important for us to just keep in mind the context of those cases and how we can make the efforts that we can to drive those numbers down, prepare for the most challenging situation, yes, province-wide, and in regions, understanding that some of these outbreaks happen at certain public events in certain regions. So we're prepared for the worst, if you will, provincially, prepared for the worst in specific regions where we may need to react, but most certainly taking action to make every opportunity that actually isn't the case.
Britton?
Now, you said that now that you've had more cases, you can kind of lower the age range groups there to give more clarity. There's been a lot of calls for more information from the public and everywhere about who's getting this and who's most at risk. I guess, is there thoughts into further information clarifying, like maybe instead of the 3 major provinces, the way the province has been split up now, decreasing that to include more regions to just kind of a better idea where this is happening?
So I think, we have to remember that what we saw in China and South Korea were that they did a lot of testing, and they still saw cases predominantly in the older age groups. And it appears that this virus, unlike influenza, predominantly causes symptoms in people who are older, who have underlying risk factors. We are prioritizing testing in those age groups. Not to say that younger age groups don't get infection, but they don't get very mild symptoms. They may get no symptoms. They may not transmit very well. They may get just a dry cough, they may be infectious for 3 or 4 days. So our message is that if you have traveled, stay home, irrespective of symptoms. If you have a cough, no fever, you don't even need to get tested. Stay home. If your symptoms go away, you complete your 2 weeks, that's fine. If your cough persists or you get fever, aches and pains, call Healthline, do the risk assessment tool, call Healthline. So automatically our testing is biased to those who need a clinical diagnosis, both if they have traveled or otherwise. A lot of the testing that is in the younger age groups is actually healthcare workers. We want to prioritize testing for those who are in the front line. So if a healthcare worker gets a cough, they're immediately tested. Most of the time the test is negative, and that's really good, so they can continue to work. Obviously they shouldn't work if they have a fever, but that's a priority population for us to test quickly, as well as other first responders. So the testing results are also biased by who gets tested, but generally the data so far is that any age group can get infected, and we have 4 people under the age of 19 now, but for the most part, the more serious manifestation is in people who are older adults.
On that as well, we should all be taking preventative measures as if it is in our community, no matter the size of the community that you live in. If whatever our rate is as we move through this, and we're making every effort to lower not only the length of flatten the curve, if you will, but also lower the infection rate of this. And that's what these measures are about today, and have been about each and every day that we come out here. But we should act with our social distancing measures and everything that we do with an eye to that it likely, if it isn't in our community today, it likely will be at some point in the very near future. And our actions with respect to how we social distance between one another, how we interact, should be with that in mind. In saying that, your question is a fair one as we move through this. And I will ask the Minister of Health to consider how this may be communicated, if you will, understanding that there may be at times regional outbreaks. The region, people living in that region likely should know that there has been a regional outbreak, in particular, if you're working in that region or living in that region. So I think in fairness, we should all act like it is in our communities, because it quite likely will be at some point in the near future. So we should just act like it is. But second, we need to continue to endeavor to report as accurate of information as we can, but always protecting individuals' privacy rights as well.
We have time for a couple more questions. We're going to take a last question from the phone line, operator.
We have Allison Bamford with Global.
Is there a question on the phone line?
Hi, yes, this is Allison with Global. In regards to the diagnostic services disruption for outpatient centers in West Central Saskatchewan, I'm just wondering if you could provide reasons for this adjustment, and should other communities expect similar temporary closures?
I don't have any specifics on that. We can get that.
I was in West Central.
West Central communities.
And there's been a diagnostics disruption there? I'll endeavor to check on that with the Minister of Health. We'll get back to you, Allison, with respect to if that has been some of the pullback, if you will, on some of our elective procedures that are occurring, or whether it's something else that is the reason behind that.
Lisa?
And one other question in regards to the SHA lab work that's been scaled back to adjust for more COVID-19 testing. Just how much of a difference do we expect this will make? Is it either going to expect faster testing or just simply a higher volume?
So there was, and we can get more specifics on that, but there were some tests that were, so obviously tests that are critical for other communicable diseases will obviously happen. And by the way, we learned that some parents are not coming on time to keep their immunizations up to date. So immunizations are important, because if we don't vaccinate our children for the next 2-3 months, then they are at risk of other communicable diseases like pertussis and measles. So vaccinations are important, but when you go for your appointment, again, the principles are which apply any time you go for a healthcare visit, but just more attention to spacing out the appointments, no crowding in the waiting area, hand hygiene. But we will continue to test for other communicable diseases. We're already reducing the respiratory panel for influenza and other respiratory viruses, because we're tailing off the influenza season. So that's giving us more space for COVID-19 testing. That is a similar process but a different test. So we are already, our laboratory partners are already making those adjustments, which would have meant that in a normal year we would have just reduced the respiratory panels as we tail off the flu season. Now we're actually increasing the respiratory panel to do COVID-19 testing, but at the same time scaling back the respiratory panel because we're coming out of the flu season.
Lisa?
In recent days, we've been seeing increases of 4 and 6. Today it's 14. Is there any specific reason as to why it's so large today?
I don't have that detail, but it does seem to, for no particular reason, those small numbers do fluctuate between that. And at this time, I have no other information about whether it was a group event exposure. But obviously, over time, we will be disclosing that information as well.
And you talked a little bit about kind of the snowbird situation, but just to clarify, are you expecting large increases in the coming days?
So I don't have an idea of what the volume of travel is within Saskatchewan and for which jurisdictions. Obviously, nationally, they did give estimates of, I've heard estimates from the federal government that there are 3 million Canadians outside of Canada. Not all may choose to come back. Some may be long-term expats who live and work in, other parts of the world, and they may, be comfortable staying in place, and that's good as well. But people who come back every spring, for example, I don't have a good idea of what the volume is within Saskatchewan, but we know that people do return if they've spent the winter south over March. So certainly we'll see that over March, and then that may tail off towards April, May. There is a level 3 travel advisory for traveling anywhere outside of Canada. It's not a travel restriction, but it is very important for all of us to consider any unnecessary travel outside of Canada, because that will continue the cycle. Now, if you go out and come back, that'll continue the cycle as long as the risk outside of Saskatchewan is higher than the risk inside Saskatchewan. So I think that is important for us to reconsider our discretionary travel for the next little while. Plus, of course, the challenges that people face, that they may travel out of Canada, but then they get stuck because the country itself is closing its borders, the flights are not available. So there's lots of complexities due to COVID-19 beyond getting ill when you're abroad to, changes that are beyond your control in terms of changes in travel plans.
And the numbers, the increases that we're experiencing, they do fluctuate a little, and this is something we were talking about a few days ago with respect to some of the restrictions that we have imposed over the course of the last week or a little better. You really don't get to see whether the impacts of those, and nor can you measure them until maybe 8 to 12 days later. As the infections happen, and so you make these decisions in the hopes that it will, flatten that curve, 10 days or so out. The decision we made around mandatory self-isolation on people that are returning from international travel was an exception to that, in that it was immediate. Not only were we suggesting that you would self-isolate when you return, but it was immediate that you do self-isolate where you return, and it was our hope that will address some of those numbers that are travel-related, and then a lot of what we're talking about with social distancing and some of the clarity that we're providing businesses that may operate in the weeks ahead and may not operate in the weeks ahead are to address some of the community transmission that we know is there now and we expect.
We have time for one last question, staff.
I just, one's a clarification and an actual question. So, caregivers, do you mean that daycares are gonna be allowed to stay open?
Yeah, we, at this point in time, we are continuing with the existing recommendations we have around daycares, which I believe was eight children per room or 8 in a daycare. And then we've also allocated the spaces from the daycares that we had that were adjacent to schools for healthcare workers and those that we are going to know we will need in the weeks ahead.
Also, you and the health minister are comparing Saskatchewan and the COVID-19 situation here to what we've seen in China and other parts of Asia, but that doesn't really seem like a fair comparison, not only given the fact that we had a head start on knowing that this virus could be coming here, as well as China had much more aggressive testing and much more aggressive containment of this. So how is that a fair comparison in any way, shape, or form?
Well, I would say that we've acted, when you look at China, for example, this COVID-19 was able to operate there or spread there for 10 weeks unchecked, because they didn't know what that was. We were, relatively speaking, have acted much sooner than that with the actions that we have taken. We also don't take a back seat on the level of testing that we have done in this province. We've done the second highest per capita level of testing in the nation. Saskatchewan has the only province that has done more testing per capita is the province of Alberta. And that may speak to the counts that we have, the positive IDs that we have. So we feel that we have acted in this province appropriately at the appropriate time with the decisions that we have made, and we're going to continue to make just these types of decisions as we work our way through this. As we said earlier, we'll focus on restrictions. We will then focus on the resources that we can provide, and we're into a combination of both of those today. As we find ourselves on the backside of this curve, then we do need to start focusing on what the recovery, an economic recovery, will look like here in Saskatchewan and across Canada. With that, I would just say that part of those resources that are being provided, they're not all from the province. And I would just commend the federal government on their decision today to provide $2,000 to any of those that are on EI or have lost their job due to COVID-19 restrictions here today.
That's all the time we have for today. Thanks very much for participating, everyone.